But at 40, naturally for every human being, both male and female, at 40, a lot of things begins to change in your body. And when I mean body, or I mean human beings generally, I always speak in 3 dimensions. The spirit man, the mind, which is the soul, and the body.
I'm really not sure where this would end up, but I kind of had this nudging to have conversations with entrepreneurs and, people that I know that are doing amazing in their fields, and sort of create a platform where these entrepreneurs come to share what they know with people. I think as one gets to 40, you start to look at life differently. It's like we now start to become our fathers. I will now start to want to teach or tell people or advise people in terms of how to live your life. I think this is my own expression of doing something like that. So I believe that when somebody watches this or hears it anywhere they might, they will benefit from it.
Okay, so the issue with being 40, the issue with being 40 is that at 40, it's 2 sides. So a lot of people tell me that at 40, I think that I'm experiencing midlife crisis. So I now ask them, what is midlife? Explain what you think midlife crisis is. Yeah, because if our life expectancy is 52 now, it means our midlife should be 20 something.
Yeah.
Abi? Yeah, so it's not. But at 40, naturally for every human being, both male and female, at 40, a lot of things begins to change in your body. And when I mean body, or I mean human beings generally, I always speak in 3 dimensions. The spirit man, the mind, which is the soul, and the body. The 3 of them are the 3 concepts of wellness. So the Bible says that man is God, in the beginning God created man in his own image, Abi? And the Bible says that God is a spirit. Okay? So what God created was a spirit man with a soul, that is the mind. Okay? And he put them in a body. So the 3 of them cannot exist independently. So that is why the definition of total health is a state of well-being, spiritual and physically, mentally, socially, and now they've added spiritually. Okay? So, and not necessarily in the absence of disease. So there's some people that they are not sick. They are not sick, but they don't have mental wellness. They don't have total health. I don't know if you understand that definition.
I totally get you.
Okay? Yeah. So that's it. So at 40, a lot of things needs to be checked. If you don't check them, it's going to cause things that were actually preventable that you didn't, check at that point. So that's where the issue is. So 40 for me is a tiebreaker in health.
It's a tiebreaker.
It's a tiebreaker for me. It's a tiebreaker for me. At 40, At 40, I tell everybody, know your number. You need to know your numbers. 40, blood pressure, sugar, cholesterol, body mass index. If you don't, it's a problem. And a lot of people don't want to check. It's at that point you are busy. It's at that point you need to pay school fees. It's at that point as a man, your mental strength is being tested with one business. And this economy, I give kudos to men in this economy. If nobody wants to take kudos, I'll take the kudos, because it's actually, the mental part of it is very, very important. Very, very important. And a lot of people trivialize it. I was giving a lecture on International Men's Day, and I had to intentionally speak about stereotypes and stigmatization. The issue of men being tagged as superheroes or superhumans. You are a man now, why are you crying? You are a man, you can deal with it. So as a man, normally, we try not to share our issues or our problems with others. Yeah, we only share our issues or problems with people who we suspect can help us. So our partners, especially our wives, we expect that you have a problem, tell me now. But you cannot help me now. Why am I telling you? What's the point? But they don't understand that part. So it's all those stereotypes that we're trying to break.
To be honest, we started this conversation. I like where it has tended to, because I think this was not the original design, and I'd like for us to come back to some of these things. I'd like you to introduce yourself. Just tell us a little bit about yourself in terms of your profession.
So my name is Dr. Diya Ololade Oluwadamilola. I am Yoruba. I'm a medical doctor. I'm a specialist family physician. I'm a board certified lifestyle physician, a board certified cognitive behavioral therapist, a board certified clinical sexologist, and recently board certified. So I have a master's postgraduate diploma in artificial reproductive techniques and reproductive medicine. Okay, so that is the medical part, the clinical part. The admin part, I'm a member of the American College of Healthcare Executives and a member of some other healthcare organizations, both home and abroad. And I also offer medical advocacy programs like medical retainership for corporate bodies and for companies, financial institutions, and the likes. Okay, so I've been doing this now I've been a medical doctor for about over a decade, about 13, 14 years. And I've been practicing active medicine for the past 12 years. I'm married, happily married with two beautiful kids. I'm Yoruba, I'm married Igbo. What else? I think that's it. That's about it.
Fantastic. You mentioned a lot of things that I probably didn't know about you. And it just actually blew my mind, because I know you. You've treated me, and I didn't know these things about you. Is it on your LinkedIn bio? Let me even ask that.
Yes, it's on my LinkedIn bio. Most of the things are on my LinkedIn bio. You can check on my LinkedIn. Yeah.
Oh, next time I'll do my research. All right. So let me ask you this now. With all these things that you've mentioned, what are the things that people come to you for, particularly those that are above 40?
So as a family physician, yeah, what usually happens is that I see people from cradle to grave. What that means is that it is from the beginning, from delivery till geriatrics to death. That is the scope. So there's this saying in family medicine that you know a little bit about everything. You know small of about everything. So my scope covers everything from internal medicine to obs and gynae to some procedures that I've done, surgical procedures, and also pediatrics. Okay, but I have strengths in different specialties. One is counseling. So a lot of people, for one reason or the other, have this nudge to want to share things they have not told anybody before. They want to share them with me. And that has been, so I'm very grateful to my therapist and to my wife, because that has actually been a burden on me for the longest of time. Okay? There are some things that people have told me that I cannot, I'm taking it to my grave. Okay? So counseling is one. Then general practice, people in this age bracket want to usually do health checks. And because I have invested my time and done due diligence to ensure that I have a broad knowledge about what people within that age bracket, 38, 45 and above, go through, both male and female, I tend to see more of those kind of people. Okay? So common things. One, non-communicable diseases. The common non-communicable diseases are the metabolic syndrome, hypertension, diabetes, dyslipidemia, and obesity. Okay? Then I mentioned earlier about mental health, especially for the men. A lot of people come to ask me about questions. How do you think I should do this? How do you think I should do that? For those non-communicable diseases, it is their complications that bothers me. The complications of non-communicable disease, like especially, so I will group the complications under the metabolic syndrome. The brain, stroke, diabetes or hypertension can cause a stroke. Okay? Hypertension or diabetic retinopathy can affect the eyes. It can affect the heart. You know, it can affect the blood vessels, arteriosclerosis. It can affect the kidneys, hypertensive or diabetic nephrosclerosis. Then in males, it can affect the male sexual organ. It can cause erectile dysfunction and the likes. So these complications are what I usually, or people usually come to me with. So I now have to take them to the beginning. That's why I've been clamoring for people to check. You need to know your numbers. For blood pressure, 140 over 90. 140 is systolic, 90 diastolic. For diabetes mellitus, fasting blood sugar, random blood sugar, HbA1c. HbA1c less than 6.5%. For cholesterol, total cholesterol less than 200 milligram per dl. Yeah. Obesity defined as BMI greater than 25 kilogram per meter square. So all these are numbers. So if you have those four parameters and you can put your numbers together and your numbers are ideal, I think you will do great. You mentioned one more thing lastly. Cancer has been an issue also.
Okay.
You have been seeing recent cases of people who are young coming with cancer of the gastrointestinal tract. I even recently saw someone with, so when I mean gastrointestinal tract, cancer of the stomach, cancer of the rectum, cancer of the colon, prostate cancer. Recently I've seen not two, three, 45, 50 manifesting in situations like that. So those are also very, very important.
All right. You've touched on two very interesting things that I wanted to discuss with you about. One of the non-communicable diseases that you mentioned runs in my family. Most people in my family are hypertensive, and it's sort of been a worry for me. But about 3 years ago, I also lost my brother, and it was it was a complication that came about as a result of diabetes, and that's that experience kind of left me in a bad state because at a point I started to think, am I next in the family? I probably haven't told anybody this. This is probably the first time I'm saying this out in the open, but I had that feeling like I was next, and it really took me on a dark path. I had to come to the point where I have to go back to the beginning, more or less, to try to ask myself certain things, try to sort of put my mind in a better, get my mind in a better place, so to speak. And what followed was also a conscious effort towards improving my health, improving my diet, and, things like that. You mentioned the mental aspect, and, it's actually very true because to some extent, I think every man goes through it, and we do our best to hide some of these things. But I like your approach as it relates to wellness in general, in that, you consider both mind, body, and spirit, total wellness. I saw a post, that you made on WhatsApp about young men dying. I don't know what the thought was around that, and I actually wanted to respond. What was it that you noticed that made you actually post that thing on WhatsApp?
So what happened was, over a quick succession of time, I think over a period of 2 weeks, I had been called early in the morning to either rush to a place, either Banana Island or Nikon Town or a house in Lekki Phase 1, to come and either certify someone dead or there was an emergency that someone slept and didn't wake up. So if I'm not exaggerating, in 2 weeks, in 14 days, I had certified not less than 10 men dead. And as in, I got there and they were already dead. They had already passed. Yeah. And nobody could explain. The wife is just saying that he slept, said he was hungry, something he thought his chest was paining him, he thought he had ulcer, So I started to count in quick succession and I was like, something is definitely wrong somewhere. So these people were not my patients. There was none of them were actually my patients or some people that I knew directly. They either called me, maybe it was the neighbor that said, let me call a doctor. I think there's a doctor that can wake this guy up. Let's see what. So they call me, I rush down there. Sometimes they use ambulance to pick me. So I sat down with my younger doctors and I was telling them that I think a lot of people are allowing what is going on in the environment make them ignore their health. Healthcare everywhere is expensive. Yes, to do a proper health check here, especially in this axis, is expensive. That's why I appreciate what most diagnosis centers are trying to do. They're trying to put together a health package, and the same thing we're trying to do at Atlantis. We're trying to create a health package for male and female that's affordable, that you can see value for. So many people are actually not checking themselves. That is firstly. Secondly, our busy schedules has taken us away from exercise and proper diet. So the simple things that our fathers, our forefathers or our grandfathers used to do in the village, get up early in the morning, the air you breathe is fresh, it's not polluted. You have to walk from, Lekki Phase 1 now, you have to walk from Lekki Phase 1 to Obalende and back to go and fetch water, or you have to walk from here to Surulere to go and, all that is exercise. These people grow their own food in the back of their house. The vegetables that they, but everything has changed. Everything we eat is processed. Now, because of the sabotaging economic situation and the lack of proper agencies that will verify the things that are being brought to this country, you will see, I'm sure you've seen videos of people injecting things in chicken that are imported, or they're putting some coloring in watermelon. People are just consuming everything. We're just consuming everything, toxins that you're inhaling it. So your body is dying. Our spirit man, people are not connected to their spirituality. A lot of people, because of COVID especially, would rather not even go to church. Then the soul or the mind, we have social media. When you wake up in the morning, you just see that they've increased the price of. So we are working against, everything is working against you. So it is, if you are a Nigerian and you live in Lagos especially, it is you 0, life like 200 or 10. You understand what I'm saying? So I think all these things have added up.
I gotcha.
And the cumulative effect of the cumulative effect of these negatives, is telling a lot. So there are a lot of people that are ticking time bombs. There are people, hypertension is a silent killer. There are people with blood pressure of 180 over 110 and 200 over 140. They are moving all around the place. All they need is that particular time where they will go and lie down, and they just do that last breath and they are gone. So that's what I realized that is happening. Lastly, now, please don't call me a conspiracy theorist. 2019, when COVID started, before COVID even started, I knew something was coming. I told people who wanted to know. I hope they will get to watch whatever it is, whenever it is, and they will affirm to that. But I didn't know it was going to shut down everything. I didn't know it was going to shut down economies or shut down both the club and the church and the mosque. But it happened. When the COVID vaccine came, I don't have anything against the COVID vaccine. I took 3 of them. Okay? But I saw a publication by an Israeli doctor. I happen to be in one group. We call ourselves the International Medical Group. We are 24. I'm the only African. This Israeli doctor called for a meeting and said that with the advent of the COVID vaccine, that a lot of people are going to be dying of heart issues. Then I asked why. And his explanation was, there's a gene expression in a particular kind of people. Whether black or, I don't know what the gene expression, he mentioned it. Whether black or Caucasian or Hispanic or Asian, this gene expression or this gene expression doesn't go well, or it doesn't bind appropriately with the receptors of the COVID vaccine. Whether you have that gene or whether I have that gene, I cannot even tell. But with the advent of this COVID vaccine, a particular amount of people are either going to have heart issues or are going to die from unexplained death. You understand what I mean? But the issue is that, like I said, I'm not a conspiracy theorist. I'm telling you what, I don't know if I'm meant to even share this information, but I'm putting out there that there is something that has to do with COVID vaccine that is not right in the heart. So he ended his presentation to me by saying that, Dr. Diya, tell your HNIs to get defibrillators. Why? Because he's anticipating that there's going to be a lot of heart attacks or cardiac arrest, or people dying from, from people slumping or dying from. And I agree with him. I have counted at least from 2022 till date, at least I've counted at least 50 people who I know that have died. Now, I can't tell you whether it's from the COVID vaccine or from comorbidities or from underlying illnesses, but I can tell you for free that it is not in the ordinary. Let me put that in. I hope that answers your question.
Wow. Yeah, it does. It does. Let me ask this, knowing what you know, and being that, you preach about wellness, and you mentioned the mind, you mentioned, the body and the spirit. A lot of things points to the body because we here in Africa are, very, like say, physical in a sense, but the way we live these days has forced a lot of people to be sitting down often and things like that. And, this has a resultant effect. You also mentioned the spirit and you mentioned the mind. Knowing what you know, what are some things that people can do so that they can live better or, maintain good health, in those three areas?
So I'll do this quickly. I have an acronym anywhere I go to give a talk. Anywhere at all I go to give a talk, a health talk, I always use this acronym. And the acronym is F.R.E.S.H. F.R.E.S.H. F is for food, a balanced meal. You need a balanced meal, a very balanced meal. Very, very okay. Fruits can also be part of it. Food and food. Very important. The R is reduce stressors. You cannot remove them. So you reduce them as much as possible because that is tied to your mental health. Okay. The E is exercise. Regular, daily, consistent 30 minutes of physical activity. Very, very important. S is the sleep. The H is health checks and immunization. Food, reduce stressors, exercise, sleep, health checks and immunization. So, F.R.E.S.H is important because it is something that you can look at and have a glance on how to improve or achieve total health. You want to improve your health? Follow the F.R.E.S.H guideline. You want to achieve total wellness or the concept of wellness? Follow the F.R.E.S.H guideline. The last thing I'm adding to that F.R.E.S.H is staying hydrated. You need to drink water. Drink safe, portable drinking water. That's what you need. Okay? Let me just say something about this sleep. The reason why sleep is important for me because I'm a nocturnal human being. I'm very active at night. So I've had this as an entrepreneur, the books, the podcasts, the TED Talks I've been listening to. A lot of people talk about as an entrepreneur, you don't need to sleep. And I started listening to it when I was very young. So with medical school also, when people are sleeping, I'm awake. And so I'm trying to break out of it. I'm hoping that when I get to my $1 billion mark, I'll just say, okay, fine, I think I need to start sleeping. Okay? But again, I know that most of the things that I've achieved, I got it when others were sleeping. Okay? But so the metaphor of burning the midnight candle was something that I did. And okay, so let's go back to sleep. I know how important sleep is. The smallest functional unit of the brain is called the neuron. They have a half-life of 24 hours. After 24 hours, the ideal thing for them to do is hand over to the next set of neurons and die off. Okay? But if you do not intentionally sleep or intentionally shut down, some people get home, they put their laptop on their chest and they're pressing their laptops, and they sleep off. Some people have their phones like this and they're pressing it and they sleep off. A particular part of your brain is still left activated. So this is what happens. The neurons are imprinting like this on your brainstem. They are imprinting like this. Okay? After 24 hours, they should hand over to the next set and die off. But if you don't intentionally shut down, they now start, malfunctioning. Now, most people get up and go. What I mean by get up and go, they just wake up from their bed. Normally, when you wake up from your bed, you should sit down for about 2 minutes. Let the blood circulate properly to your body. Because if someone get up, actually, I know people who, I'm late. They quickly get up. When they get up, they have orthostatic hypertension. They feel dizzy. I know people who fall down and hit their head and have traumatic brain injury and So some people get up and go. From there, they go to the shower. It's in the shower as they are brushing saying their morning prayers, and they rush and go and get. So what happens with the neurons at that point is they begin to misfire. They begin to misfire like this. And again, when the next set of neurons are meant to come, they are meant to clean off the brain, the clog and the residue from the previous day. They are meant to clean it off. Yeah? But because these guys are still doing their work and they are now malfunctioning, everything is stuck there. That is why people in Lagos, early in the morning in traffic, are usually agitated and angry. And you'll be surprised why are people angry? It begins to affect their mood. It begins to affect the way they see things or the way they think. That is why sleep is very good. Okay? So you need to sleep. How many hours do you need to sleep as an adult? 6 hours, but you need to have restorative sleep. What I mean by restorative sleep is that people who sleep, and when they wake up even more tired than when they slept. There are a few things that can cause that. Not shutting down properly, sleep apnea, the kind of environment to sleep. Your bedroom is meant for 3 things. I call it the 3S. Can you guess?
Sleep, sex.
Sleep and sex and what?
I don't know.
No, sleep, sex, and what?
Spirit?
Sick. If you are sick, you need to be in bed.
Okay.
Sick. If you are sick, you need to be in bed. Okay? That is the importance of sleep. So for the last one, the H is for health checks and immunization. So I did a research and I realized that regular medical checks, appropriate first aid box in the homes or in the offices, and appropriate immunizations reduces hospital visits by more than 67%. So those are the things men can do. Follow Dr. Diya's F.R.E.S.H guidelines and stay hydrated. It's simple, right? At least I try to make it as simple as well. It's not as complicated as medical terms.
It's very clear. It's very clear. Oftentimes I even find myself, and I know a lot of people have this habit, that before they even sleep, they have their phones with them and, literally sleep beside their bed pretty much. I know that I've done that a lot of times. I charge my phone close to my bed, but I read somewhere that if you can put your phone in another room so that you are not drawn to it. Another thing too is blue light from fan. Like I have this rechargeable fan that has blue light. And at some point it felt like I wasn't getting good sleep. At some point I was like, could it be the blue light from the fan? So I now tied something around
the infrared light on the TV. So if you have a TV in your room, which is not ideal, you shouldn't have a TV in your room. Like I told you, the bedroom is for sleep, sex, and sick. If you have a TV in your bedroom, when you want to turn it off from the wall, so that when you turn it off with your remote, that red light under is infrared. It activates the part of your brain that still keeps you awake.
So true.
So the same thing with that blue light on that fan.
Thanks. So you mentioned neurons and how they, operate in shifts, more or less. Does that mean that I don't know, maybe it's the neuron. I hope the neuron is not responsible for memory in any way, because I'll be afraid if I don't remember something the next day.
Like I said, just like how the hepatocytes are the smallest functional units of the liver, the neurons are responsible for everything that goes on in your brain. Sight, gait, that's balance, speech, memory, everything. These are the neurons.
Operations.
So, exactly the powerhouse. So some people. So there's this argument between my professor neurologist and professor cardiologist. So my neurologist is saying that it is the brain that powers the whole body, but my cardiologist is saying that it is the heart that that even feeds the brain. But both are equally as important as each other.
So what do you think is a healthy shutting down process when somebody wants to sleep?
So personally, so I'm going to tell you from personal experience. Different people have different. So I'm going to tell you from personal experience. So what I do is, when I decide I want to sleep, I usually ensure that the room, first of all, so there's what they call room hygiene or sleep hygiene. There are different guidelines for that. Different sleep clinics have different protocols, but the room needs to be clean. It needs if you want it to be airy, you can open your windows. But if you are using air conditioner, you make it at a temperature that you like, that you are comfortable with. So some people like it very cold because they want to hide under the duvet. The room needs to be dark. So some people cannot sleep they cannot sleep in a dark room. It has to be bright, maybe because they are afraid of nightmares or whatever it is. Okay? Then what I do is I take about 5 minutes to appreciate myself and appreciate God for what has transpired the day before. Okay? Just like some sort of mindfulness, some sort of meditation. God, I thank you for this patient. This how, because this is our work. My own field is like a battleground. You can go to war and come back with victims or come back with fatality. So when I go back home and say, thank God nobody died today, and if I didn't help anything, if I didn't do anything at all, I helped somebody today, and Father, I thank you, blah blah blah, and I just slide off like that. There are times when I'm watching football and I sleep off, but when I get up, I turn on TV. I do that before I go to bed. So you need to intentionally I don't know about putting the phone in the other room, but you need to intentionally close that laptop. Intentionally put that phone on do not disturb or put it on offline mode or something before you can now, sleep.
There was something that I saw online, and it regarded taking sugar. Basically, what I saw was that sugar promotes salt retention. That when you take sugar, your body starts to retain more salt. Is that true? And what can you say about that?
Yeah, so physiologically, yes, it is true. And it's a sequely. From there, so that's where that my metabolic syndrome comes into play. Metabolic syndrome, hypertension, diabetes, dyslipidemia, obesity. If you develop one of either of the three, either hypertension, diabetes, or dyslipidemia, the chance of developing the remaining two is at 87%. Either by pathology, when there's a problem, pathophysiology, when there's a problem in the function, or treatment. I will not stress on that. So let me just explain that. If I develop hypertension, my chance of developing diabetes mellitus and or elevated cholesterol levels is at 87%. Either because there's a problem, that's pathology, or there's a problem with the function, the way my heart is functioning, or what I'm using to treat the hypertension is leading to a complication of diabetes. Okay? So what happens with sugar intake? When you consume sugar, glucose, your insulin levels rises because it needs to meet up and break down the sugar. Okay? When these insulin levels, when they rise, it gives instructions to the kidneys to reabsorb water and salt and keep them. So the reabsorption of the water and salt leads to salt retention. The continuous increase in sugar consumption, increase insulin production, increase salt and water retention eventually leads to a high blood pressure. That's why I explained that connection before. That hypertension, diabetes, this big connection. Yeah. So if you are diabetic, your chance of becoming hypertensive is also increased. So there's another pathway for that. Another pathway is when you eat salt, whether intentionally or unintentionally. Intentionally, I mean, some people, when they go to a booker, when they buy food, they've not tested the food, they just carry salt. Okay? That's intentionally. But unintentionally, that's anything that is in can, that is edible. Yeah? was most likely preserved with salt. Corned beef, geisha, sardine, sausages, sweet corn, green peas. Those things were preserved with salt in the container. So when they even manufactured those things in the beginning, it will be difficult for you to taste it because you taste the salt inside. They need to leave it on the shelf for about 6 months for it to simmer down before they begin to ship it. Okay? So when you eat that, because we are blacks, what gives us this black color is melanin. Okay? When you eat anything that has salt, both intentionally or unintentionally, like I explained earlier, your body will keep the salt. When your body keeps the salt, when you drink water, by the automatic buffer system in your body wants to dilute that salt, so it also keeps the water. The keeping of the water, keeping of the salt, increases your blood volume. When your blood volume increases, by way of total peripheral resistance, that automatically increases your blood pressure. That is why one of the treatment modalities or the gold standard for treatment of hypertension in black people is giving diuretics. Diuretics is the medication like hydrochlorothiazide, indapamide. Olden days they use diuretic. Okay, what the medication does is that it removes the excess water, excess salt from your body while leaving the potassium in place.
Fantastic answers. Honestly, I'm learning a lot, and I'm sure that anybody that watches this video is going to learn a lot from what we're discussing here. This one was something that you posted one time, and I saw it when you were saying, guys, get your prostate checked. And I know what it means to get your prostate checked. And I was like, oh my God, is this what I'm going to allow? I want to ask this question, in terms of prostate health, 2 ways that I want to look at it. What are some things that we can do to improve our prostate health in terms of, the things we take and put into our bodies? But also, are there symptoms that one would need to see? How do we detect it? How do we manage it? And how can it be treated long term?
Okay, so for things you need to eat or do as regards prostate, try as much as possible to stay away from processed foods. Because I can tell you for free that no urologist will be able to tell you that this is what causes prostate cancer or benign prostatic hyperplasia or prostatitis. Okay, let's say prostate issues generally. Let me not break it down. Okay, so reduce smoking or quit smoking. Drink a lot of water, because the prostate, people have asked me, Dr. Diya, what does the prostate do? The prostate doesn't produce sperm. It nourishes the sperm. It gives the sperm the quality to be able to fertilize an egg. Is it important? Yes, it is. Without the prostate, can you still have sexual intercourse? Yes, you can. Okay, so those are, I'm just telling you frequently asked questions that people come to my DM every day to come and ask me about prostate. That's why I like this prostate question. So what should you do? Exercise regularly. I've seen this post about this guy who said you need to have sex 21 times in a month for you to avoid cancer of the prostate. Okay? Or sex regularly. So 21 times in a month means that if your partner is on a period for 5 days, you should avoid that. Then if you are trying not to get pregnant, you should also avoid her when she's ovulating, which is about 3 to 4 days. That's 9 days. Okay? Now, my textbook says too much sexual intercourse and lack of sexual intercourse predisposes you to cancer of the prostate. It's not like I don't believe all those things. I read it to pass. But my own take, if you ask like you've asked me personally, I think you should do what you can do. Nobody should put pressure on you on telling you that have sexual intercourse 21 times in a month for you to prevent. There are people who have sexual intercourse 21 times. If you want to have cancer of the prostate, they have cancer of the prostate. That is not science or medicine to me. People who have a family history, very, very important. People who have a first-degree relative, either an uncle or a father or a brother with prostate issues. When I mean prostate issues, there are 3 main ones. Prostatitis, infection of the prostate, benign prostatic hyperplasia, which is the non-malignant type of prostate issues where the prostate is enlarged, then cancer of the prostate. Those are the 3. So eat well, sleep well, reduce stressors, do not drink, do not smoke. You can drink socially, because life is not that hard. Okay, then get your prostate checked if you want to reduce the incidence of cancer of the prostate. Because I'm going to go straight to that. Now, what do people need to do? A lot of people, the first thing that they read on internet is a DRE, a digital rectal examination to check for cancer of the prostate. Okay, and it discourages. So that's the only thing they read. They are discouraged. They don't want to come to. They don't want to do anything. They don't want to even go. I say, Uncle, have you checked your prostate? Say me. I will not allow them put a hand for my this thing. I say lie. I say, Uncle, that's not the first step. According to the textbook, before you do a blood test, yes, part of physical examination, you should do a digital rectal examination. But when you know that people are not, or men, because most men don't like people to go to that place, yeah, you do a PSA, a serum, a blood test, a serum PSA. The normal value is from 0 to 4 nanogram per dl. So there's a free PSA and there's a total PSA. I'll not bother you with all that. The total PSA, the value is from 0 to 4. If you have a first degree relative, like I mentioned earlier, either a father, a brother, or uncle that had prostate issues, from age 40, begin to check your PSA. Because the earlier you pick it, the better. But if you don't have a first degree relative or you're not sure, the guideline says that from age 45, begin to check your PSA. If you notice that it is getting higher, you now begin to, there are protocols. PSA normal, leave it. Continue to check every year. PSA elevated. There's a family history of cancer of the prostate in your family. Okay? As the PSA is getting elevated, first of all, you can do a scan. You can do a prostate scan or do an MRI of the prostate to check if it is malignant or not. If it's malignant, it's cancer of the prostate. If it is not, it's called benign prostatic hyperplasia. Okay? If it is not cancerous, if it's benign prostatic hyperplasia, and you are having symptoms. So for the symptoms, for medical school, I use FUN, F-U-N. Frequency, urgency, nocturia. Frequency, you want to go to the restroom regularly. Because you are not emptying your bladder completely. Urgency, when you want to pee, or you want to void, or you want to empty your bladder, you cannot hold it. You need to quickly go. Then nocturia is passing urine more than 4 times in a sleep cycle. From the time you sleep and the time you wake up, you are going to pass urine 4 times. So I use for the symptoms, I use FUN, F-U-N, frequency, urgency, nocturia. And that is what we call lower urinary tract symptoms, LUTS. So if you have those symptoms and you've done a scan, you've done an MRI, they say it is benign prostatic hyperplasia, you can take medications and ensure that you have your follow-up appointments with your urologist. The worst thing that can happen to any man with prostate issues is if that individual or that patient has what they call acute urinary retention. So what happens is this pipe that carries urine from the bladder to the outside, it passes through the prostate. If the prostate gets enlarged, it closes up that pipe. Okay? And if it does that, it will be difficult for you to pass urine. So urine will now begin to accumulate in the bladder. You either need to do suprapubic cystostomy or you pass a urinary catheter to decompress that bladder. Okay? But if you now do an MRI and it's saying that it is suspicious to be cancerous, there's a Gleason score that they use. Okay? The ideal thing to do is to go and take a biopsy. That is one that a lot of people do not like because it's the procedure that I don't find it. They say most people say I don't find anything invasive when it comes to medicine. I don't find it invasive because of the value the patient is going to benefit from it. So if they test it and it's cancerous, your urologist will give you the option of either removing your testis by doing an orchidectomy. Urologists do an orchidectomy when they suspect that the hormone produced by the testis is one feeding the prostate. Okay? Or you do a radical prostatectomy. A radical prostatectomy is when you go and remove the prostate completely. Because when there's no prostate, there's no prostate cancer. I hope this helps.
For people that have experienced this and heard most of the things that you said, and they feel like they need to have a doctor, maybe they don't currently have a doctor or something, or maybe they want to reach out to you to maybe book a consultation or ask you a couple of questions, how can they reach you?
So a lot of people complain that I don't pick my calls, and the reason for that is I can be very busy, and people usually book appointments to see me. So I'm currently an executive director at Atlantis Pediatric Hospital, but I also double as the deputy director, one of the deputy directors of clinical services at Atlantis Pediatric and Multi-Specialist Hospital. So usually if you want to see me, you need to book through my hospital PA. Yeah. So I do private consultations sometimes when I'm in the mood, but for me it needs to be worth it. If and I'm sure I hope you understand what I mean by it needs to be worth it. Okay? Because I can't attend to everybody. I have a patient size of over 15,000 people. And like I mentioned earlier, my practice is family medicine. My family, and I think everybody who can afford a lawyer and a financial advisor should get a doctor on your side, a family practitioner to be precise. Because if you want generational wealth, you need generational health. You need someone who can pick diseases in your family that you cannot even see and predict what the sequence, or we'll call it precision medicine now. That's my next line of specialty that I'm going to look at. When we can predict when this family line is going to have this kind of cancer and begin to prevent it from the beginning. Okay, for those who want to reach me, I would advise that they reach out to me on all my social media platforms. Ask the Celeb Doctor on Instagram, X, TikTok, Facebook. Okay, and you can look me up on LinkedIn, Dr. Diya Ololade Oluwadamilola. Okay, so that's it.
Fantastic, Doc. You've been amazing. Thank you so much. This has really been a fantastic session. And I hope we do this again soon.
You're welcome, sir. Good night.